CBS42 wants to make sure you stay heart healthy. This morning we're taking a look at the difference between a stroke and a heart attack and how you can prevent both of those. Joining us now with more on how you can stay healthy is Dr. Cobia from Grandview Medical Center. Dr. Cobia, thanks for joining us. You know, I'm a daughter of a two-time stroke survivor, so it's very dramatic to see that play out. What is the difference between a stroke and a heart attack functionally?
Yeah, thanks for having me, Andrea. There are some distinct differences that you can look out for. In a heart attack, you're looking for things such as, obviously, centralized chest pain, shortness of breath with exertion. You know, there's kind of a specific, maybe shoulder pain that can happen. You can have loss of consciousness. With a stroke, you're really looking for potential sudden loss of some sort of neurologic ability that you had previously, okay? And again, the key word there is sudden. And there's really 5 main symptoms I like to teach about when talking about this. The first one is speech issues, like we discussed with your mothers, the sudden inability to find words or understand speech, sudden slurred speech. So that's one thing to look out for. The next thing is weakness, okay? And this is kind of a little different than just generalized weakness or fatigue. You're looking for weakness on one side of the body or the other, or on one limb or the other, okay? Numbness is the other one. It's very similar. Not generalized numbness or tingling, really vocal numbness in one arm, one leg, or one side of the body or the other, okay? Facial weakness. Now, this is something that becomes important for people around someone having a stroke, and that sudden facial droop on one side or the other, okay? And then the last one, sudden vision changes, all right? This can be in one side of the visual field or the other, or in one eye or the other, again, sudden. So it's speech, weakness, numbness, you know, facial weakness or facial droop, and vision changes, okay? There's a mnemonic that the American Heart Association likes to, you know, distribute. We've been trying to distribute it through the city and really the state of Alabama. It's the mnemonic is FAST, F-A-S-T, F for face, A for arm or arm weakness, S for speech, and then T is for time to call 911. And that's really potentially the most important thing we talk about here, is that if you notice any of the symptoms I've discussed, there's, you know, you don't call your PCP or your primary doctor, you don't get in the car and drive, you call 911 and you go to the, you know, the nearest emergency department, because there are interventions we can do if you get here fast enough. But if you wait too long, we you know, our hands are kind of tied.
Right, that is such good news. And with my mom, I watched these exactly like you said. It's textbook how it played out, and it's hard to realize this is happening. Immediately go to the hospital, and like you said, you get there, time can save your life.
There's no such thing as a false alarm in the stroke world. I mean, if you suspect it, you go in, and if it's not a stroke, well, then that's just good news, okay? But just don't wait.
Right, don't wait. All right, 20 seconds left. Can you give us just 2 tips to help us avoid something like this?
Yes, okay. You know, control your blood pressure. You know, if you smoke, please stop smoking. Diet and exercise, those big ones, okay? 30 minutes a day, 5 times a day of just an exercise that takes you to a sweat, okay?
That works, because we want to stay out of the hospital and stay healthy. Many of these actually preventable. Doctor, thank you so much for joining us. We appreciate what you do. God bless you for that.
All right, thank you.
And we'll be right back here on the